Southeast Kansas has seen a small increase of respiratory illnesses. This is KOAM News. I'm Tanya Bach. KOAM's Nellie Lopez stopped by the Community Health Center of Southeast Kansas to get an insight of what is spreading.
According to the CDC, there has been a rise in respiratory illness across the state of Kansas. But it's not something new to Southeast Kansas.
In terms of whether or not that's more numbers than normal, it seems like it's always pretty consistent during respiratory season, and it has been certainly this time. But it's still there. I know that I diagnosed quite a few COVID cases just the other day, 4 in one day. So it certainly is still around.
But COVID isn't the only thing going around. Kansas Department of Health and Environment show there has been an increase of influenza cases with the new year.
Respiratory illnesses kind of all come together. So we see COVID, we see flu, we see RSV, especially in kiddos, but then I've even had adults who have been hospitalized most recently with RSV, so it's certainly going around. So this is kind of the time of respiratory illness. So be aware, be diligent. If you are exposed to someone who has an illness, get yourself tested, get yourself seen.
Whether it's COVID or the common cold and flu, remember to take precautionary measures to protect yourself and others.
Especially if you've been exposed or you're feeling sick, it's best to stay home, self-isolate, and not possibly expose other people to any sort of virus that you might have. If you get, let's say, diagnosed with COVID in the early stages and you do have some risk factors for possibly worse disease, you can take a medication called remdesivir, which is a medication that we use to kind of help improve the symptoms of COVID and potentially decrease the risk of worse COVID outcomes.
In Pittsburgh, Nellie Lopez, KOAM News.
Dr. Emily Linhar says it's time to get checked by a professional once you start feeling fatigue and shortness of breath.